we first need to consider what lessons COVID-19 taught us. We've learned a few things. First, we have gaps in public health magnified by problems with health equity and access. Second, for such challenges, we need strong leadership that coordinates responses and collects timely, actionable data. And third, much of what we do in health might be done virtually. So consider some background here. 2 months before the pandemic began, a major study was published measuring pandemic preparedness across 195 countries. The US was predicted to rank first in pandemic preparedness. But when the pandemic hit, we did really poorly. So why? In that study of multiple parameters, the US ranked high in areas like labs, epidemiology, response time, but in a small subset, the US ranked poorly, including socioeconomic resilience, access to healthcare, communications infrastructure, and political risk. The lesson: if our healthcare system does not function as a system, if there are substantial health disparities, and if, when tested, it lacks central political leadership, then the effectiveness of those other assets is undercut. Attention to healthcare access during the pandemic was also magnified as 27 million Americans lost their employer-sponsored health insurance. Also, we can contrast the US response with that of other federated countries like Germany to see that since viruses don't respect state borders, early and strong federal leadership is required to develop testing, contact tracing, protective equipment availability, and critically collect high-quality, real-time, actionable data. Lastly, a major learning came in telemedicine. The level of adoption, which might have taken 10 years, occurred in about 10 weeks. Many physician practices went from exclusively face-to-face to exclusively virtual overnight. So will these learnings of the need to address access, disparities, federal responses, and virtual integration, will these result in changes in the nation longer term? I don't know. I think so in the area of virtual approaches. I also think the currents flow in a supportive direction to address access and disparities. Political leadership, I think that remains a wild card.